where this next exercise is especially useful is when you try the Faber's test. So you bring your ankle onto the top of your knee, on the upper part of your knee, and just let your hip just rest there. And you notice how high your knee is off the floor. So here it's about 3 of my widths of my hand. And I can feel, is there pain in my hip? Does it feel really tight? Is it tight in the front? Is it tight around the back of the joint? So I just noticed that. We do the same thing with this side. And for me, it feels a lot easier on this side. So I'm actually tighter in this hip, in this Faber test, which is a test of joint tightness generally. And that joint tightness can be opened up by muscle activation and also some stretching too, whether it's stretching for the capsule or stretching of tight muscles around the hip too. So it's sort of to do with bone orientation causing joint tightness. And I'm just noticing which is which. And then what I do the exercise that I'm about to show. And then what you can do is test this straight after. And most of the time you'll find that there's that knee that's a bit high will come down a little bit, if not quite a bit. And it's definitely do this exercise on both sides. So this is both an activation exercise for the glute and also a hip opener, and also a stretch for the adductor magnus and the adductor longus. So how you start off this, kneeling on both knees, and you can have your feet either like this, which I tend to feel is best, or you can have your foot flat too, whatever I feel here protects the kneecap a lot more. Don't recommend doing any sort of thing where you're leaning on your kneecaps on a hard surface though. Have a couple of towels or a yoga mat underneath. You can stir up a bursa at the front of the knee. So never on a hard surface, I don't recommend. So we've got that first to start. Then this next part's like we're doing a hip flexor stretches in terms of the leg goes out to the front, but instead we make the leg go out about 45 degrees. And it's about 90-degree angle here. You can play with the angulation, but about 90 degrees is good to start. And the key thing as I do this now is that I keep my pelvis tucked under. So that means it's tucking under that way, like you're trying to tuck your tailbone under. So that stays under the whole time, so a little bit of a tuck, and my hips are staying relatively square to the front. It's not letting my hips turn to the line of my knee. I'm more opening this way, so the hips are facing forward. And then this works a little bit with the weight. It doesn't have to be too heavy, but you can be surprised how heavy you can go actually. So I'm just staying upright with my body, so I'm not leaning forward, I'm not letting my back round. Pelvis tucked under, then I just go forward. I'm putting pressure through the knuckle of my big toe, pressure through my heel, knuckle of the big toe, and the big toe as well itself. And I'm pushing back. And the key thing as I do this, I'm keeping my knee open as if I had someone trying to push my knee inwards, and I'm resisting them. So I'm keeping the knee pushed out this way the whole time. So this makes the stretch happen here, makes it happen into here. The stretch happens through here, also through the hip capsules as I do this. And I go as far as comfortable, then I actively push through that foot and come back. So about this speed is good, and the whole time I'm keeping this knee pushed out this way. So I feel this glute on this side, on my left side working. About 15 reps is good. 2 sets of 15 is good as a warm up before you do squats, before you do leg day at the gym. 3 sets is also good too. It's a great way to warm up your hips. And of course do both sides. I'm staying straight with my body, so I'm not leaning like this, I'm not doing this, just staying vertical the whole time. So you may feel a stretch go down through here,